Welcome back. You're watching the Prime Edition. Now, the Kenya Union of Clinical Officers, KUCO, has accused the government of ignoring their grievances that saw them call a strike that is now on the 16th day. The workers who marched to the Ministry of Health offices on Wednesday demanding better pay, implementation of collective bargaining agreement and the absorption of the universal health coverage, UHC staff into permanent and pensionable terms. The health workers have called for dialogue with the government to resolve the ongoing strike, which has disrupted services in all public hospitals.
On Wednesday, the Kenya Union of Clinical Officers marched to the Ministry of Health as the industrial action hit the 16th day. This comes as negotiations with the government remain stalled, a situation that has compromised service delivery in public hospitals across the country.
We have been dealing with only one item. The reason was that the SRC and Treasury had not made decision. But we are much aware that for the last 4 months, the SRC and the Treasury have made decision about what was still pending. One clause have taken us for more than 3 years.
We presented our petition on 9th. Though there is no officer who came to receive, we still served. But up to date, we do not have any response, and we have not been called for a meeting by either this ministry or the Council of Governors.
The clinicians, led by their chairman Peterson Wachira and Secretary General George Kibore, are decrying of lack of implementation of their collective bargaining agreement, signing of the return to work formula, payment of salaries arrears to global health staff, absorption of universal health workers to permanent and pensionable terms, among others.
The SRC has improved the enumeration of national health workers, but they have left out the county government staffs. And I think these people are trained in the same college, they have the same skills, and they have the same knowledge. That is very discriminatory.
There can never be UHC without healthcare workers. So, Bwana President, let your people walk the talk. You promised to confirm 7,514 UHC healthcare workers, but that has not been implemented.
The agreement that they have made with the union and also healthcare workers at national and also at the counties. It is quite unfortunate that we are here now doing demonstration. Kenyans are left out without any form of treatment.
The stalemate has stretched the capacity of other medics in hospitals and is impacting health outcomes in public hospitals.
And these cases of misdiagnosis do not emanate from the fact that these clinic officers are not qualified. It is because of occupational fatigue. According to documents of this ministry, as we stand here today, we are supposed to have 24,000 clinic officers in the public health system. As we stand here, we only have around 6,500. So one clinic officer has to see patients for 4 clinic officers.
Clinical interns have also lamented lack of supervisors as their superiors remain out of office, compromising the safety of patients.
We are not like all these other cadres or departments whereby you will confuse something and you will delete something from the computer or you rarua that karatasi. At the end of the day, when we make mistakes, people die. People die when we make mistakes. We need supervision, and this supervision cannot be done if our people are on strike.
The union leaders have called on Health Cabinet Secretary Aden Duale to urgently convene a meeting to end the stalemate. Kasichana Masha, Prime Edition.